to today's Visiting Angels Coffee Chat, and we're so happy you're here with us today. Here at Visiting Angels, we know that caring for an aging loved one can come with a lot of questions, emotions, and uncertainty, and especially when families are trying to figure out what support and resources are available. And that's why conversations like this are so important to us. And we're so lucky today. This session is all about helping families better understand the programs, services, and community resources that can support seniors in aging safely, comfortably, and with dignity at home. And one of the beautiful things about Coffee Chat is realizing none of us are navigating these challenges alone. And, a few housekeeping notes before we begin. We actually have four wonderful speakers joining us today. We broadcast two speakers, but actually we're having four beautiful people joining us and each bringing different experiences, insights, and resources to share with you. Now, as questions come up throughout the presentation, please feel free to place them either in the chat box or the Q&A box at any time. We'll be gathering those questions I'll be reading them for you as we go, and at the end we're gonna open up for Q&A.
At
Q&A.
Visiting Angels, we're committed to enriching the lives of elders and their significant others. Our monthly coffee chat sessions aim to make your lives easier and better by providing quality information from our expert panelists. We're here to elevate your quality of life, offer practical wisdom, and ensure you have access to valuable insights.
I'd like to introduce to you our wonderful first speaker today. And her name is Jill, and she has been in the home care industry for over 16 years, working closely with both clients and caregivers to help seniors age safely and comfortably in the setting of their choosing. She's a certified dementia practitioner and certified senior advisor who is deeply passionate about helping other adults and families navigate the aging journey with compassion, dignity, and practical support. Today, Jill will be sharing valuable information about Visiting Angel services, community resources, dementia support programs, and so without further ado, let me introduce to you Jill. So join me in welcoming her. Jill, the floor is yours.
Thank you so much. Can you hear me okay? All right. Okay, so through this presentation today, I'm going to do some introductions and I'm going to discuss just an overview of Visiting Angel services, and then Lamar and Niake will talk about a little bit about our community engagement, and then Jennifer and Niake are going to talk about the guide program as well as some other home care funding sources. So hopefully this is of interest to everybody that's here. And all right, so on our account management team, we have Joan Ecabena, who is our CEO, Lamar Folson, who is a home care consultant, Jennifer Howard is a home care consultant, Niake Forna is also a home care consultant, Stephanie Asbury is a home care consultant, and then Leo Posada and myself, we are your intake specialists. So this team is basically your first line of contact when reaching out to Visiting Angels. And so now I'm going to just talk briefly about the Visiting Angels services. So we have been providing care since 2002, and we are getting ready to celebrate our 25th anniversary of providing care in our service area. So Montgomery County, we have offices in Silver Spring and Gaithersburg. We are also in Washington, D.C., and Edgewater, but we provide care in throughout Montgomery County, Washington, Anne Arundel, and Prince George's counties. We are licensed, insured, and bonded. We have experienced caregivers who go through an extensive background check. So that includes fingerprints, and we provide award-winning care every year. So you can see those emblems on your screen. An independent third-party company specializing in experience management surveys. It's called Activated Insights, formerly known as Home Care Pulse. They produce client and caregiver satisfaction surveys, and we've received all three of these for the past several years. So we're the employer of choice, leader of choice, and provider of choice. So we, at any given time, we have about 400 caregivers, and we can provide care anywhere from 4 to 24 hours in a shift, 7 days a week. We are also an approved provider for the Veterans Administration. We're also a consortium member for the ARC of Montgomery, providing respite care, and we also work with all of the long-term care insurance companies. So what we do for people who are interested in our care, we would send a home care consultant out to meet with the interested families. We would discuss all of our services. We would complete the intake paperwork with the family. And then a nurse would come out, a registered nurse, to complete an assessment, which is really just a brief medical history that would be used to develop the plan of care, so that the loved one all of their needs would be met by their caregiver. So the caregiver would know exactly what to do to help your loved one. And then our care coordinators would review the plan of care and the schedule requested and select an appropriate caregiver. And then service would begin. So that's kind of in a nutshell. And then let me just briefly discuss our scope of services. People often wonder what we do and how we can help, who we are. So we can, like I said, we can provide care anywhere from 4 to 24 hours in a shift. We can provide assistance with bathing, dressing, and grooming. We can provide assistance with toileting if that's necessary. We can provide safety supervision, such as assistance with walking and safe transfers. We can provide medication reminders. We can provide transportation to doctor's appointments, errands, shopping. We do light housekeeping, meal preparation, companionship, and we can do everything from live-in care, respite care for families, transitional care, end-of-life care, and also specialized care, such as dementia care. And the majority of our office staff are certified dementia practitioners. So we can work with families that really need some assistance with this. And then next, Lamar and Niake, two of our home care consultants, are going to be presenting on our community engagement efforts. And so up next would be Lamar. So you can take a sip of your coffee, and then Lamar will be right with you.
Good morning. And I want to let you guys know that we do have more than one computer, just in an effort to consolidate resources. We're sharing a screen. So community engagement. So our community engagement is very important to us because part of our mission here at Visiting Angels is to provide compassionate care that enhances the quality of life for the people whom we serve. So it's vital for us as angels to be present and to give back to the community that we serve. So we partner annually with the Alzheimer's Association, and last year we raised $25,000 to fund the vital research that goes into the work to end the Alzheimer's disease and fund the research for the cure. And through our efforts, we collaborated with community partners such as Out of the Way Cafe, Gentleman Gems, Lido's, where we placed our veterans trees, where we hung bags which listed personal care items for people to donate to the veterans, such as toothpaste, razors, soap, and other personal care items. And last year we collected more than 150 of those bags and have for the past several years. We work in collaboration with the Veterans Resource Office of Silver Spring, who distributes the bags to the veterans that they serve. And we also partnered with Tropical Smoothie, Buffalo Wild Wings, Dogfish Head, Pinstripes, and many others. And on designated nights, they designate a percentage of the proceeds that they receive to the Alzheimer's Association. And this year, our partners have also donated more than $1,000 in gifts for this year's raffle, which you'll find more details about by emailing Jill G at visitingangelsmd.com. And myself and the other home care consultants also provide bingo. I'm also proud of last year providing musical bingo at one of our adult daycare centers and doing caroling at one of our local hospitals. So here at Visiting Angels, we're very active in our community and present in funding the research to end this disease. And next, you'll be hearing from Nakis.
Hi, everyone. I hope you're having a great time, and it's going to be hot today, so I hope everyone is having at least iced coffee. So I will continue to discuss our community engagement, and I will touch on the Veterans Affairs, how we collaborate and try to give back to the community, and most importantly, our beloved veterans. So as Lamar already mentioned, we have different initiatives we work with as Visiting Angels to try to give back to the community. And as part of that, we also partner with the Department of Veteran Affairs in trying to collaborate with them. We make a yearly in-kind donation through the Veteran Tree Initiative, which Lamar just mentioned. We partner with different restaurants, we get different resources, and at a particular time during the year, we try to make those presentations to our beloved veterans. We also serve individual roles to support the volunteer department at the Department of Veterans Affairs. And they have a special program called the Angels, Soul Their Angels program. So we participate with them and try to distribute comfort care items to our veterans. And in terms of services, you might want to ask how we do that. So we work with the VA through their community care program, and once that is certified by the VA, we try to provide in-home non-medical care for our veterans. And the process is pretty much simple. Remember, us as Visiting Angel, we try to create a seamless process for our veterans and the community at large. So all we need is our veterans to connect with their local VA, and someone from that local VA might be a social worker, might be a nurse or a doctor. They will do their own internal assessments, independent assessments, just to ensure that they meet certain specific needs. And once that eligibility process is done, they communicate that information to us at Visiting Angels. And the Veterans Affairs Department then provides certain authorized hours that we can send our caregivers to that veteran's home. And what is the benefit for that? The most important benefits, as we know, these are people that have served the country and we need to give them back, is that they'll be able to safely age at home. And that really reduces hospitalization because the goal is to prevent them from getting back to the hospital frequently. The next conversation we'll be having this morning, and I encourage everyone to take another sip of their iced coffee, is the Medicare Guide Program. So I will touch on this, and also Jen, who is another home care consultant, will also discuss the Guide Program. and some other resources that we have in addition to that program. So GUIDE is actually an acronym that stands for Guiding an Improved Dementia Experience. And you might want to know what is that, or why do people need this program? The whole initiative was actually created by the CMS to improve support for people living with dementia and other dementia-related issues. Because before this program was actually launched in 2024, people with dementia and Alzheimer's or certain form of memory loss were actually receiving fragmented form of care. That means there was not like a one-stop shop where they will get all the care they need, and there was a lot of hospitalization related to dementia. So before the GUIDE program, families actually struggled to coordinate cares with physicians, specialists, and even connect with home care companies such as ours. And to even coordinate simple things as transportation, it was a hassle for those family caregivers. And another important thing that was actually mentioned was the caregiver burnout. So imagine a family member who also has their own loved ones to care for, then they also have to actually care for a member of the family who also has dementia. So like I mentioned, this program was established in 2024 by the Centers for Medicare and Medicaid Services, and they plan to enroll it until 2032. So who is eligible for the GUIDE program? So anyone typically that has the traditional Medicare A and B and has a confirmed diagnosis of dementia, it can be late dementia or onset or early stage of dementia, they qualify for the GUIDE program. And also the unpaid caregivers of that person. So that means if they have a daughter, they have a friend, or the family members who directly care for them, they also will be eligible to benefit from this program. And of course, the benefactor must also live in a community and not a nursing home. So why is Medicare Part A important? Medicare Part A covers the critical hospital bill, and Part B covers outpatient services, such as the one that we also provide for GUIDE recipients. A frequently asked question by a lot of people is why are other forms of Medicare not accepted, just the traditional? Because we have the Medicare Advantage, for instance. So typically, if someone has a Medicare Advantage, they actually, their plan is covered by a private insurance company that works with the CMS. So it's not a direct Medicare coverage and benefit. And can someone with Medicaid qualify? Yes, but Medicare has to be the primary insurance before anyone with Medicaid can qualify. So I'm going to share some facts about dementia and Alzheimer's. A recent study that was actually conducted in 2024 actually stated that the fifth leading cause of death in America, in the United States, among people aged 65 years was actually the Alzheimer's disease or dementia. So that is actually alarming. And 74% of those people that are actually supporting people with dementia also, they're concerned that maintaining their own health and also caring for a loved one becomes really challenging. So now we can see where we're driving at the benefit that the GUIDE program also provides. Another fact is 70% of those supporting persons with dementia find it difficult to coordinate care. So one benefit of the GUIDE program is that care coordination will be done as some of the benefits that are offered. And of course, the high hospitalization rate of people with dementia and Alzheimer's. Now, I have a scenario that I would love to share with people because a lot of people, this might be the first time that they might have heard of the GUIDE program. So let's just look at the scenario this way. We have a name. Miss Mary is actually 78 years old. She's living at home with a daughter, and she has Alzheimer's. She has early stage of Alzheimer's. But the daughter also has to manage Miss Mary's medical appointments. She sees multiple specialists during the week, and the daughter also has her own family also to care for. So she constantly suffers from burnout. She's constantly exhausted because she has to deal with schedule and stuff like that. So this is where the guide program actually benefits that family, because with the guide program, Miss Mary gets care navigation. The daughter receives training to help her with respite care, and also she gets some other forms of support. And yes, so Jennifer, who is another home care consultant, will touch on the next phase of the Medicare Guide program. And I hope you guys are having a wonderful day. And don't forget to stay hydrated by having that iced coffee. Thanks.
All right. Good morning, everyone. I hope everyone is staying cool out there. My name is Jen. I'm another home care consultant, and welcome. We're glad to have you. So just some benefits of the guide program. We have care navigators, which offer training, support, and check-ins. And then, the respite care, and it's up to $2,563 per year in respite care. And this, someone can receive this annually every July 1st, so you don't have to reapply. Once you're in, and you're allotted those hours per year. And then medical oversight as well, so telehealth access, 24/7 access to specialty providers. And I wanted to go back just a slide to touch on something. So as Niake mentioned, some of the different qualifications, somebody would not qualify if they have Medicare Advantage or PACE. And maybe someone has Medicare Part A, but does not have Part B. You need to have both. And maybe someone who is living in a nursing home, they would not be eligible. Or if someone was on hospice, they would not be eligible as well. So just to touch on that. So how the process works. So phase 1 is the screening. So all we need is someone's first and last name, their date of birth, and their beneficiary ID number. And then phase 2 is the interview process, which, we would get their primary care provider, the address, number and email, any power of attorney that they might have. So phase 1 is very quick. Phase 2 takes about 10 minutes. And then we would have our nurse come in to do the assessment, to do, kind of get together the care plan. And the turnover rate, it lasts about 3 weeks to a month, just depending, in order to have a caregiver come in. Okay, so the ARC respite program is a little bit different from the guide. So you can have both. But with the ARC respite, it would be someone receiving 50 hours. You would get 50 hours of service. With guide, you would get 70. And with respite, you do not have to be residing with a caregiver, but guide, with guide, okay, let me go back. So with the ARC respite, you do need to have someone living with you as a caregiver, and with guide, you do not. All right, let me go back here to IHAS. We're going to go into this, and I'm going to have Jill take over here. Hello again. So IHAS stands for In-Home Aid Services for home care in Maryland. And it's a Maryland program that provides trained aides to help adults with functional disabilities live safely at home and avoid unnecessary nursing home placement. It basically is structured to provide personal care, dressing, bathing, grooming, transfers, assistance with eating, and also some chores like cooking, laundry, light cleaning, and shopping. It's really designed to help people remain in their own homes. Services also include case management to help plan and connect with other needed services. So it's a pretty robust program. Self-care training is also available to promote independence. Now, to be eligible, you have to be an adult 18 or over in Maryland with a functional disability requiring assistance to stay at home. Priority is given to those at risk of nursing home placement, at risk of abuse or neglect, or without a willing or capable caregiver. So you must be receiving case management as a part of a treatment plan to prevent or reduce institutionalization, prevent abuse or neglect, or to promote self-sufficiency. You also must agree to pay any required fee. It's a sliding scale based on your income and household size. Most of the time we've seen that fee be anywhere from maybe $2 to $5 an hour. You do have to apply for this program. It's definitely, this is something that you can also use with respite. For example, if you're using respite services, let's just say 2 days a week, Tuesday and Thursday, you could potentially use IHAS on Mondays, Wednesdays, and Fridays. So these are a lot of different funding sources that are available. We're very excited to introduce the GUIDE program. The GUIDE, it's just amazing because not only do you get the respite service, the 70 hours that you can use in the fiscal year. Their fiscal year actually runs from July 1st to June 30th. So you have those 70 hours that you can spread out. People have used them to leave their loved one for the weekend and go away. So it provides a little breathing room for people that are really struggling with caregiver burnout. And so that is basically everything in a nutshell. I know that we've mentioned IHAS a little bit. We've mentioned respite. So the great news is that next month for our June presentation, the third Wednesday of the month, we will have Jules Abate from Respite of Montgomery, which is a part of the ARC of Montgomery. She will be here to talk more about the Respite of Montgomery, what it does, what the qualifications are, and how you can get the help that you need. But all of these programs are available. If you need more information, you can certainly, if you want to know anything more about our Alzheimer's, if you want to join our team, if you want to make a donation, if you want to get raffle tickets, if you want to be attend any of our events, if you want to be a part of anything, you can reach out to me at Jill, Jill, the letter G, at visitingangelsmd.com. And we are happy to help you. And as always, if you have any questions, just reach out and give us a call. All right. So with that all being said, there are probably some questions. Dexter, do we have any questions?
Yes, we do. And before I get to that, I'd like to congratulate you for for giving a wonderful presentation. Anyway, the first question is, all right, please describe your pricing commensurate with services provided. Are your prices negotiable if original services are no longer needed?
So with any of our things, you get the GUIDE program, which is at no cost to you. However, when you run out of GUIDE hours, you can certainly remain with us to get private pay hours. So our private pay structure, it's kind of an individual thing. It's based on the level of service, and it's also based on the schedule, the number of hours that you choose to use. So I am happy to have a conversation. We can certainly talk about what meets your needs and what we can do about the pricing. And one thing about us here at Visiting Angels is that we really take pride on the fact if you need other assistance, we are a wealth of knowledge. We have resources that we will guide you to. So you're not going to be left here without any kind of help.
All right. Now for the second question. What are the limits of hours provided under the guide program?
So the guide program, so you're going to get about 70 hours. It works out to about 70 hours or so. You have to use them in increments of 4. So you could use 4 hours, or maybe if you have a longer day and you don't feel comfortable leaving your loved one, you could use 8 hours. If you're planning to go away overnight, you may want to use 24 of those hours. And you would just deduct those from the 70 hours that you are allotted. Some people, again, choose to use private pay hours, so they still have these guide hours when they need them. So 70 hours for the fiscal year. Fiscal year is July 1st to June 30th, and they have to be used in increments of 4.
Okay. All right. Next question here. Is an Alzheimer's patient eligible if they have been approved for specified low-income Medicare beneficiary from MD?
For the guide program, in order to be eligible for the guide program, you must have Medicare A and B. So and that's the first qualifying factor. And then secondly, you have to have some form of cognitive decline. So because they are authorized under a low income situation, they would have to speak with somebody so we can understand what the needs are. But generally, for the guide program, that bare minimum is that you must have Medicare A and B, and you must have some form of cognitive decline.
Okay. Next question here. I came in contact with the guide program through neurologist. Can a person reach out to you all directly?
Absolutely. So you cannot be a recipient of the guide program unless you are affiliated with a provider. So basically, you can't just go to guide and say, hey, I need guide hours. You would have to go through a provider, which would be Visiting Angels. So again, as Jennifer explained, you would give us a call. You would have your Medicare card in hand. We would ask for your loved one's name, their date of birth, and their Medicare beneficiary ID number, which is a series of 11 letters and numbers. So when you're going to look for the information, that's what you're looking for. You're looking for the 11 digits, a mix of letters and numbers. And then you would call us. We would enter the information through the system, and it will tell us immediately if they qualify. And if they do, we will do the interview, which is really like a 5 to 7 interview. And whoever's calling, you basically know the answer. So it's not like you have to go and look for stuff. We can take care of it right away.
All right, for the next question, can you get guide benefits if you are also paying for home care?
Absolutely, you can. So if you're paying for home care and you qualify for guide, you can use a mix of your guide hours and your private pay hours. So absolutely, you can do that.
Okay, so here are some more clarifying questions.
Sure.
Does the money go to you, the agency, and then you staff the hours? Can the hours be used to provide 24/7, or are there limitations on how they are used?
Okay, so once a person is eligible for guide, we get notification from our partner that the person has been aligned. It's called alignment, where they're eligible. And then we will reach out and find out how they would like to use their hours. We'll say, hey, you have this many hours. You know, how would you like to use them? They'll say, oh, okay, I'd like to use 4 hours over here, but then in 2 weeks, I need 8 hours over here. And then I'm going away next month. I want to use 24 hours over here. And so if you're using 4, 8, and 24, basically you have used 36. You've used 36 hours of your 70. So you still have hours remaining. So does the money come to us? It does in the way of, once we send out the caregiver and we're also keeping track of your hours, then we bill the guide program to be reimbursed for the service that you've used for your hours.
All right. For the guide program, did I understand we need to go through a provider like Visiting Angels?
Absolutely. Yes, you can't just go to guide directly and get hours. You have to go through a provider, such as Visiting Angels, and we will get you set up. We'll run through the qualification with you. We will do the interview with you, and then we will work with our partners to get you aligned. We'll have our nurse come out and do the assessment, and then hopefully everything will be aligned and you'll be able to start using your hours. Now, one thing that I do want to mention as well is that Visiting Angels handles the respite part. So we are the ones that are providing the caregiver for your 70 hours. However, I just want to remind you, get care navigation, caregiver support, there's telehealth that's available. You have over 125 specialty doctors, facilities, organizations that you have access to that you can use through your guide program. So it's really, when I say it's a robust program, it's very robust, because not only do you get the break of it all, the respite service, but you have all these other things at your fingertips as well that are yours to use.
All right. So another question here. I'm gonna answer this. Is this monthly Zoom program? Yes, it is. It happens every third Wednesday of the month. And I'm gonna drop the link after this presentation. Before we go to our separate way on our separate ways, I'm gonna drop the link for the next one so you guys can register once again. And again, for free, you can invite the whole neighborhood if you think it's gonna help them. Anyway, so next question. This is interesting.
Well,
With the guide program.
Let me tag on to that, Dexter. I just want to let you know some of the exciting topics that we're going to be covering in the next couple of months. So we mentioned that Jules from Respite of Montgomery will be here in June to present on the respite program and how it can be used hand in hand with the guide or alone. Jennifer mentioned that there are some differences between the two programs, and you'll learn more. And then I think in July, we have the Montgomery County Police Department's Alzheimer's, Autism, and IDD unit coming to talk and provide tips for people who may wander out of their home, and different things you can do to keep your loved ones safe. And then we'll have in August a dementia program. We will have a music therapy program. We're going to have food insufficiency program and what you may be able to do to ensure that you have food. And then in November, in time for Veterans Day, we're going to have a topic of how to support veterans and veteran caregivers. So we have an exciting lineup of speakers for you all.
Yes, true, true, true. Yeah, moving on to the next question. With the guide program, you cannot also have respite. I was approved for guide last year, and they, in Maryland, only allowed for roughly 80 hours. With respite, I already was awarded 120 hours. I was told that you cannot use both. Has that changed?
So the great news that we just found out over the past couple of weeks is that yes, in the next fiscal cycle, respite is on the same fiscal cycle as the guide program, and respite, you will be able to have your 70 guide hours, and then you'll also be able to have 50 hours from respite. So respite is doing 120 hours if you don't use the guide program or if you don't have cognitive decline. But in order to keep with the same 120 hours, you can now use the guide program, which would be about 70 hours. And then you would also be able to use 50 respite hours. But you must use your guide hours first. And you must use the same provider. So like if you're using Visiting Angels for the guide, then you would need to use Visiting Angels for respite as well. So that's kind of what we have.
Okay. Is guide for only Maryland, not DC?
You can use the guide in DC as well. We are able to provide services in Maryland and DC. Like I mentioned, we have 4 franchises here that cover Maryland and DC. So yeah, the guide program is a national program. So you have to find a provider. If you live in Tennessee, you would have to find a provider in Tennessee, obviously, who can take your information and run it through the system. But it's a nationwide program.
Okay. Here's another one. Medicare Advantage has not replaced Medicare Advantage A and B as far as we know. There's no longer any Medicare A and B that has been replaced with Medicare Advantage. So there's like 2 point of views here. If you could just clarify this. So one says
Sure.
there's no longer any Medicare A and B that has been replaced with Medicare Advantage, and another says Medicare Advantage has not replaced Medicare Advantage A and B as far as we know. So yeah.
No, so Medicare has the 2 different programs, right? You can have traditional Medicare, which is Medicare A and B. You can have Medicare Advantage. Okay, so basically, in order to use the guide program, you cannot have Medicare Advantage. You must have Medicare A and B. So there is still Medicare A and B, the traditional Medicare. So, one is basically, it's your hospitalization and outpatient. That's A and B. And then Medicare Advantage is basically through an independent provider.
Okay. Anyway, for those who are wondering if there's gonna be a replay, yes, we are just gonna be editing this episode, upload it to YouTube. So if you are not yet following our YouTube channel, just stay tuned. We're gonna send you the replay link as well as the slides. Okay, and
Yeah.
all
Dexter,
right.
just as a matter of housekeeping, just wanted to make sure that we addressed some of the questions that we saw in the chat. Just wondering if we were able to get to Jean Tinsley's question,
All
Linda's
right, G.
question.
Yeah, Jean. So here, does money carry over each 7-1, or is it a use it or lose it? Medicare.
What's the
That's
question?
one question. Does money carry over each 7/7/1? I don't know how to read this.
Let's
The
have
questions
on
from
July
Erin.
1st. Yeah.
Yeah,
Okay,
or is
so
it use it
you
or lose
have
it?
to use your hours. Your 70 hours must be used by June
Oh,
30th. And then you automatically, if you're enrolled in the program, you don't have to re-enroll every year. You will be allotted your next 70 hours for
okay.
July 1st, 2026 to
Oh,
June
yeah.
30th, 2027.
They do not roll over.
They don't roll
Use
over.
or lose.
Yeah.
Okay. Nice. Do you have a
Question from
standard
Linda.
indoor? Yeah.
Sorry.
Which
Did we
one?
get
Which
to
one do you
Linda?
want to?
Linda?
Linda
Lind.
Spiegler, she asked a question, and I would be delighted to answer.
Okay. Yeah, where is it? She asked a while ago if guide is for Maryland, not DC, so we've answered that. I'm looking for
Okay.
Okay.
her other question. You probably yeah, is there any other question from her? I've read that other one
No, okay. Just
already.
trying to make sure we covered all the bases. There was a question from Gregory.
Yeah, do you have a standard indoor environmental assessment process for new clients' home?
We do a standard assessment for all of our clients. So
And
yes,
is
Please
the assessment
clarify.
done in their home?
yes.
Yeah. All right. Moving on to the next question. Please clarify eligibility for those who have Medicare Advantage plan through their previous employer.
Okay, so for Medicare Advantage, you are not eligible for the GUIDE program. In order to be eligible for the GUIDE program, you must have cognitive decline and you must have Medicare A and B.
Okay. Via the guide program, can we have someone take our loved one to outside activities like taking them to a senior center?
The beauty of the guide program is that you can use it for transportation, so it can be used for those activities.
Okay. Last 11 minutes. I'm pretty sure we're gonna be able to answer them. Anyway, what is the respite program?
What is the respite program?
Yeah.
Through Montgomery County? So the
Yeah,
other
probably just,
program, not the
yeah.
GUIDE. So the respite program is through the Arc of Montgomery. And what that is you must have your primary caregiver living with you under the same roof. You must have the same address. It is designed to give this caregiver some respite, a break. By sending in a professional caregiver, like somebody from Visiting Angels. We are part of the consortium of respite providers. And if you're not using the GUIDE program, you would get 120 hours to use, and you're awarded hours monthly. And for that program, you do not have to have a diagnosis or any type of cognitive decline. You can just be, a lot of people use their respite hours after the pandemic and people had to go back to work. And they had been so used to living at home, being at home with their loved one during the day that they really didn't need help. But now that people are back in the office, they don't want to leave their loved one at home for 8 hours a day. So they are hiring caregivers to come in. And even if it's a 4-hour period, to make sure that they've had lunch, make sure that their hygiene is taken care of, all of those types of things.
All right. So here's another clarifying question, okay, from Amy. That is still only 120 hours total. So she asked the question a while ago. So what is the benefit of using Guide? Guide does a very intensive exam before allowing you to use it. Guide does not provide any different services than Respite. So please advise if I am missing benefits of which I am unaware.
Yes. So they are different, very much so, in the fact that with the guide program, you are getting the care navigation. You're getting, of course, the respite, which both provides, but you're getting the care navigation. You're getting access to telehealth. You are getting 120, more than 125 specialty um, services, medical people, and you also
Caregiver training.
the caregiver training and support, and also check-ins. So you're going to have care and service coordination. So, like I said, the guide program is really a robust program. And thank goodness that respite, you're able to use those 120 hours, 70 with guide and 50 with respite, because you get these other resources.
And just a little bit more of a differentiating factor for the guide program over the respite program is that the caregiver does not have to reside in the home with their loved one who they're providing care for. That can be a scenario that makes guide a little bit more beneficial as well.
Thank you. Yes, that's very true. Very true.
And then the
All right.
assessment process is not that intensive at all. It's probably about 30 minutes to 40 minutes of interpersonal conversation with the person, the care recipient, and their caregivers, just to get a background and a basis, or to establish memory loss if there's a question about qualifying. You don't actually need that formal diagnosis of dementia to qualify for the guide.
You have to have cognitive decline, and when the nurse comes
Correct.
out to do the assessment, you know, but in terms of the qualifier and the initial interview, no, like I said, it takes about 5 to 7 minutes. So it's not intensive or extensive at all.
Okay. So I thought guide program allowed a maximum of 80 hours, not 70 hours. Did the hours decrease for the next fiscal year? And let me, add a follow-up question to that. Is it 70 hours per year or per month?
It's 70 hours per year. Okay. And it hasn't decreased. When Guide first came out, they were, the math, it looked like it would be about 80 hours, but it really turns out to be about 17 visits of 4 hours each. So it works out to be about 70 or so hours.
Okay. Is there a respite program in Anne Arundel County?
So there is a form of a respite program in Anne Arundel County. At this point in time, we are not affiliated with that respite program, but there is some type of, there's an arc of Anne Arundel, and you can definitely reach out and find out what they have available.
All right. So Guide is national, is respite program nationwide, including DC as well. So that's the last question.
Okay, so a lot of counties have respite programs. Okay, we are primarily familiar with Respite of Montgomery County because we are a consortium member of that particular program. Respite is generally found under the arc of whatever the county is. So you can certainly reach out to the county where you would need care and see what type of a respite program that they would have.
All right. I believe that's it. I'm just gonna drop the link for the next month's episode. So if you are wanting to know more about respite, we're gonna be joined by Jules Abate, and yeah, you can register as early as now. So
And I
yeah.
just want to quickly jump in and really implore people to please get involved in our Walk to End Alzheimer's initiative. Last year, we are so proud that we raised $25,000. And we want to do it again this year, but we need your help to do that. So if you'd like to join our team and walk with us, it's on the mall downtown on Saturday, September 26th. Please give us a call or reach out and we can tell you how to join our team. We have many, many fundraise events planned where a portion of the proceeds will go towards our fundraising efforts. We have about 9 gift baskets that we are raffling that are driven by restaurant gift cards. So you would get a gift basket with multiple gift cards to restaurants. Pinstripes is one. We have bowling and brunch for 4 people. So if you want to get raffle tickets from us, let us know. I can tell you that on July 20th, we'll be having a bake sale here at our Gaithersburg office. You'll be able to get raffle tickets there as well, and any event where we are. If you need a calendar of our events, please email us so we can get that to you. Edgewater, June 9th, if you're reaching out to us from the Edgewater area, on Tuesday, June 9th, we will be having a bake sale in front of our building there. We will also have raffle tickets. We have we have gift baskets specifically for that area, a taste of Anne Arundel. So we have some wonderful prizes and we've partnered with some wonderful businesses. So we are excited and we want to excite you all enough that you want to participate with us. So reach out to us.
Yes, and I've dropped Jill's email address again at the chat box, or you can call us 301-355-6578. And I guess that's it. 11:59. Thank you again for spending part of your day with us, and we hope to see you at our future coffee chat episodes. Hope you guys have a wonderful, wonderful day. And thank you to our speakers, Jill, Lamar, Nyake, and Jen. Congratulations once again for giving, a really, really wonderful, wonderful presentation. So people are saying thank you here. Anyway, that's it for us. Bye bye.
At Visiting Angels, we're committed to enriching the lives of elders and their significant others. Our monthly coffee chat sessions aim to make your lives easier and better by providing quality information from our expert panelists. We're here to elevate your quality of life, offer practical wisdom, and ensure you have access to valuable insights.